Okay, welcome. It's getting near the end of the day for us here at Deuk Spine Institute on November 9th, 2023. This next patient comes from California, and he and I were talking about some fast cars earlier. He likes fast cars, I like fast cars. He hasn't been able to drive his car fast lately because his neck's been hurting him. He has neck pain. When we did his MRI review, I looked at his MRI and noticed that he had some bulging discs in his neck, and one of them in particular, C5-C6, looked to me like that's where the pain was coming from. That's where he pointed to as well. So we're going to fix his C5-C6 bulging disc today, herniated disc. He's here with his parents, 2, 3, 4, 5, 6. I don't know that we have the perfect MRI picture up for you, but I'm looking at a good MRI picture here. All right, our approach is going to be the right side because his pain goes down his left arm. Are you ready here, Sanjay? Ready to get started?
Yes, we are live.
Yeah, I believe you. All right, so let me just show you. This is his chin. He's looking up at you. His chest is here. Legs are down there. That's the neck. There's the Adam's apple. That's the middle. We're going on the right side of his neck, and he's nice and relaxed. I could feel his spine right through the soft tissue. And I'm pushing the esophagus and trachea over. Shot. Perfect. 2, 3, 4, 5, 6. I'm right over 5, 6. Let's get a quick AP and make sure we're in the middle. This is how you do the surgery, folks. It's called anterior cervical endoscopic spine surgery. Perfect. I'm going to go to the middle a little bit. And let's get a shot on a lateral view. All right. Now we call this the Deuk laser disc repair because we do it a special way. And the way that we do it, 2, 3, 4, 5, 6, shot, is we actually shot AP. We use a laser to clean out the back of the disc. Quick AP, I need to make sure I'm in the middle. Oh, it's perfect. Let's go back to a lateral view. Quick shot. All right. So I'm right here at the front of this disc. Shot. I've got to get into the disc. I'm going to advance my needle. Shot. Shot. Perfect. And one more. All right, let's count again for the benefit of the audience. 2, 3, 4, 5, 6. One more time. 2, 3, 4, 5, 6. Let's get an AP. We use AP, which is a front-back x-ray, and a lateral, which is a side-to-side, to navigate and localize for the surgery. And right now we're at C5-6. I want to just check our needle position. It's perfect. Interesting. Looks good. All right. Let's get started. We're going to start by doing a discogram. Now, there's two types of discogram, evocative and provocative. Evocative and chromo. Look at the tear in the back of that disc. Quickly. And let's get an AP. Giant tear. You guys see that? In the back of the disc, that big black tear?
Yes,
now
we do.
we'll get an AP, and you're going to see the dye leaking out into both foramen. That's where his pain's coming from, folks. He has an annular tear. One more time. It's a little blurry. Perfect. Look at the tear. Wow. Both sides. And the dye leaking out the back of the disc through a gigantic tear running from one side to the other. All right, that's what we're here to fix today, folks. We're going to get rid of the herniation, and we're going to clean out that tear. Any questions?
No questions.
Let's run the video showing the audience how is it that something like this that is a small disc herniation can actually cause so much neck pain, headaches, even arm symptoms. Shot. Welcome back. You can see from that video right there that the actual cause of all the symptoms is inflammation happening in the back of the disc. Now, take a look at this x-ray here. Jordan's going to show you the herniation. You guys see that black line there? That is the herniation sticking into the spinal canal. Beautiful. Did you get that?
Yes.
All right. I've just made my 4mm incision. Now we're going to take the needle out. We're going to bring the dilator in. While I'm doing this, I have to hold the guide wire in position. Shot. Got to check the guide wire, make sure it's not moving in any further. Shot. Okay, it's in perfect position right now. So far we've lost 2 drops of blood. This is a bloodless surgery. Shot. I will tell you a funny story that I know about this patient. Apparently he did the shot. He did our MRI review and watched our videos and just felt that it was too good to be true. So he wasn't going to come here and get treated, is what I heard. And he can tell me if that's not true in the morning. And then he talked to one of his friends that he has known for a long time, and he said to this friend, you know, I'm having problems. And the friend said, you ought to go to this place called Deuk Spine Institute, Shot. and he said, are you kidding me? I thought they were just a scam. And she said, no, they're legit. So here he is getting fixed. Now, it could be wrong, but when I heard that when he made that conversation, he was over in Asia. So it was interesting that they were talking about us while he was in Asia. All right, great. Everything's looking good. You guys see this? Yep, perfect. So the tip of the dilator, Luis, is sitting in the front of the disc at C5-C6. And I'm going to pull the guide wire back a little bit because I don't want it going any further forward. Shot. Perfect. Now you agree we're at C5-6, correct? 2, 3, 4, 5, 6. Yes, all right, let's get an AP. Make sure we're in the middle of the disc. I need a coker. We're going to verify with our x-ray that indeed we are in the right spot. You want to enter the front of the disc as midline as possible. That looks really good. We're just to the right of midline. A hair, literally about 2 millimeters, so it's perfect. Very happy with that. And lateral. All right, now we're going to advance the dilator through the anterior longitudinal ligament, or ALL. Shot. That's it? Good. Here we go. We're going to pass through the disc. Remember, the disc is fibrous. Remember, it has fibers, muscle fibers. Sorry, not muscle fibers, but annulus fibers, or what are called connective tissue fibers. Shot. And we're literally spreading the fibers apart. All right, let me show you this. So you guys see the dilator sticking in? Now we're going to bring the tube down. We're going to do the entire surgery through this skinny little tube, and it's 4 millimeters wide. You all see this ruler here?
Yes, we do.
4 millimeters. See that?
Yes, we do that. Yes, we do see that.
It's like a coffee straw. So we're going to bring this tube down over the dilator. It's going to slide down all the way to the front of the spine. Shot. Meanwhile, you want to watch your dilator, make sure it doesn't go in any further. That's Luis's job for me. He's my point man. No, we're fine. He's my point man, meaning he watches the point of the dilator to make sure that if I'm looking somewhere else, he's watching it to make sure it doesn't go in anymore. Shot. And we're just going to gradually advance the tube over the dilator. Very nice. So why did this patient come all the way from California? The answer is, simply put, they don't do this surgery in California. They haven't figured out how to do endoscopic spine surgery. What they're offering patients are fusions and artificial discs. And that's what I used to do for, 20 years. I've done a lot of fusions and artificial discs. I think that's good. I'm happy with that. We're going to take everything out, leave the tube, and we're going to do the whole surgery through it. As a matter of fact, I've done 1,000 cervical fusions in my career, 1,000. I've pretty much stopped doing them, but I used to do them every week for many, many years. About 20 years, huh? We're good? Yeah, it's good. All right. Can you guys see this? Irrigation.
Yes.
Let me just show you. Clean it up a little bit. Look at this, how beautiful it is. Okay? Now I know his mom and dad are here. I saw them earlier. They may be watching. So I want them to know, Mom and Dad, we're taking great care of your son. And his father was talking to me about how the surgery is kind of like engineering. So here's the incision, 4 millimeters. You guys see that?
Yes, we do.
It's a good picture for the site. Nice and clean. Can
Yes.
you get that for the website?
Yes.
So he's going to have his neck and everything on our new website. I think he's going to like that. You got a good picture?
Yes, we did get it.
All right. Don't forget.
Yep.
All right. It's nice having Sanjay along, because Sanjay is going to help me build our AI program for our new website. And he's learning so much. How long have you been here, Sanjay?
3 months.
3 months. And he's learned so much in 3 months. I told him the only way you're going to be able to build an AI program, a chatbot for our visitors, is if you're going to, you have to see what the questions are and what the answers are. So this is a great way to do that. Are we ready on the laser?
Yes, sir.
Now the laser fiber you're seeing, the blue is just a plastic covering. The optical fiber is the glass at the bottom, in the middle. It's a little overexposed. Let's turn the exposure down. Yeah, a little more. Yeah, that's perfect. All right, you guys see the glass fiber, and I'm literally releasing laser energy. 2100 nanometers is the actual wavelength. Sorry, wavelength, yes. Of the waves of electromagnetic energy that are used in the laser. This Homium YAG laser. Produced by actually an Israeli company called Luminous that's now owned by Boston Scientific. We've been using the same laser now for 20 years. Actually, sorry, 17 years, because I've been doing this for 17 years. 17 years we're using the same laser. It's the best laser in the world. Any questions from the audience?
No questions.
Let's show them how the Deuk laser disc repair works. Okay, welcome back. You see now how an annular tear at the back of a disc that gets a herniation in it can cause so much pain. And I'm here with the scope at the back of his disc where the tear is causing all of his pain, and he keeps getting these herniations popping out, but they're still scarred down to the annulus. They're not coming out. I'm having to go in with a laser, and there's one right there. Look at that thing. Beautiful. All right, let me try to grab that. Yeah, I think we got one right there. Yeah. Good. See if there's another one. No, a little bit. All right, so the surgery is basically going back and forth between using the laser and using the grabber to take out pieces of herniation. Here's another big piece of herniation right here. You can see how it's stuck from inflammation, scarred down to the edges at the back of the disc. So as I was saying earlier, the fiber that you're seeing, the glass fiber, is 0.5 millimeter. It's 550 nanometers. Sorry, micrometers wide. So it's a 0.55 millimeter wide glass fiber. That just gives you a little bit of scale on how big the fiber is. So that glass part at 12 o'clock that's moving around, I'm manipulating its position and making it remove herniation. That thing is 0.5 millimeter wide, just to give you an idea of how big everything is for scale. Lots of herniation over here. Lots and lots of herniation. All of this is herniated disc. Okay. Years ago, I was contacted by an Israeli neurosurgeon. They wanted to learn my technique. I offered for them to learn it, and then I never heard back from them. They were in, I think, Jerusalem at the time. Do you remember that, Luis? We were talking to that guy. They were supposed to fly us out. Maybe it was just too expensive for them. Yeah. That would have been pretty damn cool. I have never been to Jerusalem. I would love to go. Huh? Not a good time to go now. That's true. Yeah. But it'll get better. I'm confident. It will get better. What we're seeing here are the fibers of the posterior ligament right there. We're in the foramen where the nerve root is. I'm right above the nerve root, and if you want to be specific, I'm anterior to the nerve root. We're at the back of the disc. We're seeing the tear. You're seeing the bones there on the left and right, the end plates, and we're looking in the foramen right here. Literally looking out the foramen. You can see the giant tear, right? You see that tear? Uh-huh.
Yes, we do.
We're at 20, right?
Yes.
All right. Now this is a nice disc for us because you can see it's not so degenerated. But there's a giant tear right there. You see the tear? That's crack is the tear. And I'm cleaning it so that it will heal. It will heal once we get rid of all the herniation. Any questions from our audience?
We have a comment from Josh on Facebook.
Uh-huh.
Looking forward to talking to you tomorrow, Dr. Deuk.
Ah, wonderful, Josh. Thank you. Josh, where are you from? We have patients from all over the world. I'm going to flip my scope and start looking the other way. We've pretty much cleaned out the foramen on this side, but let's go see where else there's problems. We haven't really gone to the other side yet. Oh, there's a tear right there. You guys see the tear in the back? I got 5 minutes left maybe, doctor. That's a tear in the posterior ligament. There's a little bit of herniation there. We just have to be really careful. See the tear?
Yes, we do.
Yeah, that's the spinal cord down there. That right there is the spinal cord. Just behind that. Beautiful, huh? Beautiful. Absolutely beautiful anatomy. I'm being very careful right now. We're right on top of the spinal cord. We don't want to do any damage. But people ask me, how can you make sure you're not going to harm it? Well, we are a neurosurgeon. So as a neurosurgeon, it's my job to operate in these areas and to do it properly and safely for the patient. This is the other side we're going on the disc. Remember, his tear is, we saw the dye leaking out bilateral, but that's where the dye leaked out, by the way. That tear right there. Now, that tear will heal itself. Now that we've gotten rid of the herniation that was there, that will heal itself. He just needs some time to heal. All right, any questions for me?
No questions.
Great, we're just about done, another 2 minutes maybe. You can see the scar tissue over here from the chronic inflammation, and I'm just cleaning as much herniation as I can. Something you should keep in mind, there is no surgeon in the world that can remove 100% of the herniation. The most we get is 80%, average is probably 60%. Okay? You really want to try to get 50%. That will give you good relief for the patient. I've been removing these herniations now for 26 years. Just about done, guys. 26 years we've been taking them out. And, oh, there's one right there. That's a good one. It's scarred up. Gonna have to blast it with a laser. I think I was telling you earlier about the luminous laser that we're using from Israel. Wonderful. It's the best laser there is. It's a holmium YAG used by many different kinds of doctors in medicine, from urologist to OB-GYN, and of course to neurosurgeon. They use the what?
The YAG laser and plastic surgery.
Oh, plastic surgery.
Yep.
What do they do with it?
Laser hair removal.
Hair removal.
Resurfacing too.
Really?
Surfacing.
For acne scars.
Oh, good.
Yep.
Well, it's very popular. It's a very safe laser. That's why we use it. It's safe and effective. All right, that should be it. Let's go look one more time. There's a little piece there. A couple more little pieces here. These are pieces of herniation. They were hiding right behind the tube. I want to try to get as much of these as I can. They're the ones that cause the inflammation. Oh, he's been hiding a few from us. Look at them all come out. How many is that? Each of those are about 5 millimeters in their widest dimension. Ah, Nikki,
Yes.
I need you to do me a favor.
Okay.
I need to contact one of our patients from a few weeks ago. Check on them. That's it. Let me just look the other way. We're done. Let me just finish this. Just a little bit here, we'll be done. I don't see any more herniation besides this. This is on his left side. Big tear, it's going to need to heal. Beautiful. This is the annular tear. And this will heal. It just takes a long, long time. That's the mistake some people make. They think, oh, I can go back to, you know, aggressive sports or physical activity because the pain is gone. The pain is not the indicator of healing, okay? You have to wait, be patient, and then you only have to do the surgery one time. Otherwise, you'll re-herniate and have to come back. Any questions?
No questions.
All right, go ahead and type up any questions you have for me. I'll come and answer them, but we're pretty much done. That's the foramen, and I'm very happy with the results. I'm going to come and answer the questions for you face to face. So type them up for me. But we're done. And go ahead and go to one of our patients who had this done recently. A testimonial, if you would. Here, let me show you. Can you see?
Yes, we can see that.
All right, now you can go to testimonial. So you do one little Band-Aid and Good morning, I'm Dr. Deuk. I'm here with one of my patients who underwent surgery yesterday with the Deuk laser disc repair on his cervical spine. And he's here less than 24 hours from his surgery. And how are you feeling today?
I'm feeling great. No more neck pain, no more arm pain.
So you came to us here at Deuk Spine because you were having neck pain and it was going in your right arm and it was affecting your work, your quality of life, right? Tell us about that.
I first started noticing a lot of arm pain and a lot of weakness in my right side arm, and that's my dominant arm, so I knew something was going on. And then finally I went and saw my primary care, who took me to a MRI, and that's when I noticed that I had some issues going on. And he referred me to Deuk, and I'm very pleased that I didn't have to search around. I was real confident from watching all the videos and testimonials that I would be the right choice.
Yeah, and you can see in your surgery here, we made a tiny little cut on your neck in 2 spots. 4 millimeters, because you had 2 discs that needed to be fixed or were separated. And we used the laser to remove the herniations along with the endoscope. We did an annular debridement, cleaned up the tear that was there in the back of your disc. Everything went really well. You didn't have to have a fusion, did you? I mean, that's what most doctors will tell their patients. They need a fusion or an artificial disc.
Correct. I didn't have to get the aggressive plates put in. I'm real happy that it was just 2 little holes. That's it.
And it was outpatient.
Yes, I was home laying on my couch within an hour after the surgery. So
within an hour. Yeah, that was nice to be able to recover at home.
Yeah.
Not have to go to the hospital.
Correct.
Well, is there anything else you want to share with your audience?
My wife and I both came in a little nervous yesterday, and the staff just comforted us and very professional, very caring, explained everything from the beginning to the end. We were very pleased that we chose this route.
So what's life look like for you now that you got these symptoms gone?
I'm hoping to go sit on the beach this afternoon.
And you will. Very good. Congratulations on taking it and doing so well.
Thank you.
All right. Have a nice day. I'm Dr. Ari Deuk with the Deuk Spine Institute. We have a patient who just had surgery yesterday. And if you were tuned in online watching our live surgery broadcast, you saw her get 2 discs fixed in her neck. She's had a prior fusion done with an ACDF and a metal plate, so we fixed the disc above the fusion and below the fusion. She had adjacent segment disease. And how long were you suffering with neck pain and right arm symptoms before you came to Deuk Spine to get it fixed yesterday?
Over 20 years.
Over 20 years.
Over 20 years.
And you had the Deuk laser disc repair done. You can see we had to make 2 incisions on the front of your neck. How do you feel after the surgery you had yesterday?
Awesome. Never felt like I've not felt like this, and I couldn't tell you how many years. I've not been able to actually have a normal life due to the pain. Hurting so bad, having to lie down during pretty much after lunchtime.
Do you still have that pain right now?
No, sir.
It's gone.
Gone, yes.
Yeah, your neck is still a little stiff, and you
Yes.
got to get used to that. But you did have the fusion, fusions always cause neck stiffness, and we can't fix that. But the pain we can fix. So the pain you had before is gone.
Yes, sir.
You happy?
Very, very happy. That's an understatement.
Now you have a funny accent because you come from Bluff City, Tennessee. Isn't that right?
Yes.
All right. And why did you travel to Florida for your surgery?
Done a lot of research, and then I found you. Thank God. Greatest blessing that I've ever had. Best doctor I've ever been to in my life.
Thank you.
I can't really put into words how I feel. It's beyond. It's the greatest blessing ever. It truly is.
Well, I'm glad you're doing well. I know your husband is here. He's been very supportive. He was here throughout the surgery yesterday, and you can actually see in the video footage that we made 2 tiny little 4mm cuts in the front of your neck, went down through the neck, not damaging anything inside, and getting to the herniations where the tears were. And actually, you could see the tears on the discogram that I did. And they were big, and we were able to get in there and clean out all the herniations with the laser, and we didn't have to do fusion anymore. We didn't make your neck any worse than it came here with. And the nice thing about the Deuk laser disc repair is it's a stabilizing procedure, getting rid of pain and neurological compromise. I checked you today. You came to us with weak arms, and now you have normal strength in your arms just 12 hours, 24 hours after your surgery.
Yes. Not had that in so many years. So many years.
All right, well, is there anything else you want to say to your fans out there?
Anybody suffering with chronic pain, you have no idea. It is well worth coming to see. Like I said, he's the best doctor I've ever been to in my life. He actually cares. First doctor I've ever had in my life to hug me and ask me how I'm doing.
And compliment you on your nails.
Exactly. He loves my nails.
I
He
do
loves
love
my
your
nails. Highly recommend him, like I said. Very well worth everything. He truly does care. And the team here is awesome. The nursing staff, everybody was tremendously, I can't express enough how everybody was so good to me and just went out of their way to make sure that I had everything I need. I was comfortable. You know, it was just a very wonderful experience. It truly was.
And I appreciate you sharing. You also had the Deuk plasma rhizotomy, I just remembered, because she had facet joint pain as well as the disc problem. And she was having pain turning her head to the right, weren't you?
Oh yeah, I couldn't. I was having extreme pain. I was turned into when I couldn't hardly turn to my right. It was going down into my right arm extremely bad.
And that's gone.
Yes.
Amen. And it's gone permanently. So I'm very happy for you. When are you heading back home?
Saturday morning.
All right. Well, enjoy Florida for a few more days. You take care of yourself. You've got my phone number if you need anything.
Yes.
All right.
I thank
take
you
care.
so very much.
You are more than welcome. It's my pleasure to take care of you.
Even with my funny accent.
All right, let's get you out of here, okay? Go enjoy the beach or something. All right, what a wonderful testimonial that was, and I still remember caring for that patient. Yeah, so we just finished this patient's surgery, and he had really one bad disc in his neck. It was torn in the back, it was herniated, it was causing a lot of pain in the neck, and it was miserable. So he came to Deuk Spine Institute from California. He's actually from Northern Cal, Silicon Valley area, and he was being offered fusion, I'm sure, as an option by the surgeons there. This is what I used to do for many years. This is it. I did cages. You can see the cage, you can see the plate. The problem with this surgery is if you got nothing better than that, then it's great. But if you have endoscopic laser surgery like we did, then that's a far better surgery. There's no metal, there's no fusion, there's no cage, there's no cutting the skin and harming the body. You know, with fusions, their complication rate is 50%. That means if you're going for an ACDF fusion, flip the coin, and you got a 50-50 chance of having a serious complication from the surgery. That's too high. With the Deuk laser disc repair, the one we just did right now, the complication rate is less than 1 per 1,000 surgeries. So it's a far better surgery to do. All right, we have a question, I understand.
We have a question from Rick on YouTube. How long does recovery take after the pain has been relieved?
Well, Rick, how long does the recovery take after the pain has been relieved? His pain is going to be relieved today. So how long does the recovery take? It takes 1 hour to recover from the surgery. This patient you're watching right now literally will wake up in about 10 minutes, and he's going to go home in about an hour. When I say home, I mean the hotel, because we want to see him in the morning for a quick checkup. But basically tomorrow he'll be driving. He can go back to work tomorrow if he wanted to. There are some minor restrictions, of course, but recovery is 1 hour.
We have a last comment from Bill on Facebook. He says, so happy that I chose Deuk Spine Institute.
Thank you, Bill. Great to hear from you. All right, folks, have a wonderful evening. It's Thursday. We'll be back on Tuesday. I don't know what we have scheduled, but if you check out the calendar, you can see what we have scheduled. We have 4 surgeries, I'm being told by Cassie. Do you know what we have?
I believe it's 2 cervical, 2 lumbar, but don't quote.
We think it might be 2 cervical, 2 lumbar, so it should make for an interesting day. Thank you, Sanjay. You've done a great job today. I want to tell you how much I appreciate it. My team did a great job. Have a wonderful evening and weekend, and I look forward to spending more time with you all next